Okay, good afternoon. Is my audio clear?
Yes po.
Yes, sir.
Okay, sige. So as a continuation of our discussion, so we have finished last week red cell morphologic abnormalities, right? So we have dealt with anisocytes, anisochromia, and poikilocytes. When you say anisocytes again, what's the variation or changes you expect on your red cells?
Sizes.
Of the size, right? When you say anisochromia, what's the variation in red cells morphology?
Color.
Color again, which is then reflecting the hemoglobin content of your RBCs, right? And when you deal with poikilocytes, it varies in
Shape.
Okay? So, for today, as a continuation of red cell morphologic abnormalities, we are going to deal with certain inclusion bodies. If you will take a look at a normal red cell, or for example, this one. If you will take a look at a normal red cell, what you have is, under a right stained blood smear, what you have is just a simple pallor area, right? How much pallor area?
1/3.
1/3.
So you have that pallor area, then everything is red, right? Everything is red, and you have that 1/3 pallor area, so red cells are deformable. Red cells can expand, right? So if there will be any unwanted materials as you observe them under the microscope, it may then be referred to as inclusion bodies. Okay? And generally, you listen well, generally, when you deal with red cell inclusions, most of them actually are formed because red cells failed to mature properly. Red cells failed to develop properly. Let's say there have been deficiencies in certain nutrients needed by red cells, or there's really an insufficient amount of a particular protein or a particular substance within your erythropoietic cycle. So that's why there will be some sort of, para mas madali niya nating makuha, some sort of leftovers from erythropoiesis, from your immature cells. There will be leftover components that will be present on your RBCs because they failed to develop or they failed to mature accordingly. Nakuha ba yun?
Yes, sir.
Yes po.
So the first one that we have here is called as Howell-Jolly bodies. Okay? So as what you see on this picture here, ito si Howell-Jolly. Howell-Jolly bodies are small, round, purplish fragments you see within your RBC cytoplasm. And usually, this dot here, this small fragment here, is a result or a product of karyorrhexis. Pag sinabi nating karyorrhexis, what does that mean? Uy, anyone, what is karyorrhexis?
Yung nuclear disintegration.
Pag yung nucleus ng isang cell ay nasisira or binibreakdown, right? Among immature cells, immature RBCs, they have nucleus. And as they mature, you tend to extrude that nucleus, right? So if there will be incomplete development and maturation of cells, as you extrude out that nucleus, as you push it out, there will be certain remnants. And these dots here that you see are actually remnants of DNA. Those are nuclear remnants of DNA, which you could see in cases of megaloblastic states. Yan, last week, binanggit natin yung megaloblastic state, right? There's improper development of cells, usually caused by insufficient or incomplete nutritional requirements like B12 and folic acid. Diba? So you can have such inclusion in those cases, megaloblastic states, sometimes even in thalassemia, or if there is defective erythropoietic cycle within your bone marrow. The question is, sir, how will I know if this purple dot here indeed are Howell Jolly bodies? So what we do is we perform special cytochemistry techniques in the laboratory, and take note that the most specific reaction for Howell Jolly bodies, or the most specific reaction for DNA, kasi generally that's DNA remnant, is what you call as fulgent stain. Okay? That is the most specific reaction for DNA. That's the most specific reaction for Howell Jolly bodies. So once positive, you can then confirm that those dots that you see within the cytoplasm of your red cells are really Howell Jolly bodies. Are we clear with that?
Yes po.
Yes po.
Okay. Next one here is basophilic stiplings. Or you call it basophilic kasi, yan, as you see on the picture, you have their blue dots, right? You have blue granules, you have dark blue granules. And because of its appearance, sometimes in literatures, it has been referred to as blueberry bagel. Familiar kayo doon? Yung bagel?
Yes, sir.
Yung, ano ba to? Tinapay. Diba? Tapos mayroong blueberry toppings. So parang ganun siya. Okay? So sir, where did I derive those bluish granules? Galing yan from the precipitation of ribosomes and RNA. So when will it happen, sir? When will I have that precipitation of ribosomes, even the RNA? Usually, you can have these basophilic stiplings into two things, into two types. So we can better understand how do we form this. You can classify it as fine or coarse basophilic stippling. Pag sinabi nating fine basophilic stippling, usually you associate this with increased polychromasia or increased polychromatophilia. In a right stained blood smear, what is that cell again? Called to be as polychromatic RBC.
Reticulocyte.
X. And what's inside your reticulocytes again?
RNA.
RNA.
You have remnants of RNA. So imagine, if within your blood, you have a lot of reticulocytes, there could be a possibility of increased production from the marrow that may then result to the precipitation of those RNA within your cells. Okay? So that's one. Kaya nagkakaroon ng basophilic stiplings because there is polychromasia. Okay? Then, you may have a coarse basophilic stippling if there is impaired or defective synthesis of hemoglobin. And usually, it occurs whenever a person is intoxicated or poisoned with lead. And if you recall it last time, what is that substance inhibited by your lead?
EALA?
Diala.
Diala. Tama? Si delta aminolevulinic acid. And if you will recall it last time, the formation or the rate of formation of diala will determine the rate of heme synthesis. Tama? It determines the rate of heme synthesis. So parang ano nyo lang, gawin nyo lang domino effect. If there's lead poisoning, what happens is that you don't form heme. Right? Wala kang protoporphyrinite. So if you don't form heme, those globins that you form on your ribosomes will just accumulate within your cell. Tama? They accumulate and then later on, they precipitate. Bakit? Wala kasi yung kapartner niya. Wala kasi si heme. Kaya you can have that basophilic stippling if there is a defective or impaired hemoglobin synthesis. Nakuha ba?
Yes po.
Yes po.
Okay. So again, with basophilic siblings, you can recover this one. Ayan, pag meron kang lead poisoning, merong sometimes even thalassemia, or even in certain enzyme deficiencies related to the formation of your heme. Okay? Then, next one here, nakikita nyo ba yung bilog dun sa arrow? Yan sa monitor nyo o sa
Opo.
screen ninyo?
Yes po.
So you call it as cabot ring. Obviously, due to its appearance, right? Cabot ring. So you have rings or loops or figure of eight, which is an evidence of remnants of your microtubules and mitotic spindle. If you go back in erythropoiesis, as the cell mature, they undergo mitosis. Right? Diba? Kung natatandaan nyo sa mitosis, yung last phase. Anong last phase ng mitosis, if you recall it?
Telophase.
Telophase. Yan. Good. Diba sa telophase, that is when your mitotic spindle will totally separate. So you can have your identical daughter cells. Diba? So if there will be improper development of your cells, then there will be certain remnants of this mitotic process, such as your mitotic spindle and microtubules, which will then appear as a loop or a ring inside. Oh, that's why you call it as cabot ring. And again, makikita nyo siya if there is megaloblastic state. Ulitin natin pag sinabi nating megaloblastic state, it is formed or it happens because there is an incomplete or improper maturation of or development of cells. Most of the time because of nutritional deficiencies. Okay? Then with the next one. Ilang beses na nating dinidiscuss yan. When do you form Heinz bodies again?
Denaturation.
Denaturation of protein.
When is hemoglobin denatured?
Oxidative stress.
Oxidative stress.
And when will your red cells suffer from excessive oxidative stress?
Lack of disease.
Deficient sa G6PD.
If you have deficiencies, particularly in G6PD. Tama? O, ikutin uli natin. If you have deficiency in G6PD, your red cells are exposed to oxidative stress. Right? Once exposed to oxidative injury or oxidative stress, your hemoglobin is denatured, thus forming this Heinz bodies inside. And because of its appearance, para siyang pitted golf ball. Kasi marami siyang butas-butas. Okay? And in the laboratory, how do you recover Heinz bodies? How do you identify completely Heinz bodies?
Supravital.
Vitals.
The use of supravital staining. So you can have Heinz bodies in different conditions like G6PD deficiency, unstable forms of hemoglobin, pag meron kang sulfhemoglobinemia, thalassemia. So to further recover that, you just need to perform supravital staining. Follow-up question. What is that poikilocyte you can encounter whenever Heinz bodies are present?
Tegmasite.
Tegmasite. Good. Alala pa. Diba? You have your bite cell. Right? Because your spleen has removed the Heinz bodies, so your cell now will then appear like a beaten piece of donut. That's why you call it as bite cell. Tama? Then, the next one here is hemoglobin age inclusion. Time out lang saglit for a while. Okay, sige. So, sorry, going back. So, when you say hemoglobin H, it's actually a form or a type of thalassemia. Okay? When it comes to your hemoglobin, we'll further elaborate this later on, ha? Pagdating natin ng finance. Pero, just for your information, when you say hemoglobin H, it's a form or a type of thalassemia. Diba? When you deal with thalassemia, it's a problem of globins. Right? So pag sinabi natin hemoglobin H, there has been certain deficiencies in your globins. Particularly, tong hemoglobin H inclusion na to affects your alpha globins. Okay? So it's a form of alpha thalassemia wherein your cells become susceptible to lysis. Kaya patients with such inclusions results to hemolytic anemia. Okay? These inclusions there, yan, yung mga nakikita yung parang dots, those inclusions represent precipitated hemoglobin H. Okay? Again, that's thalassemia. Nandun lang muna para hindi masyadong malalim yung kukunan natin ng info. Okay? But think of when you say hemoglobin H, you are dealing with thalassemia. And if you want to recover this hemoglobin H inclusions here because of hemoglobin H precipitation, you can then perform supravital staining. So tatlo na yung pwede nating makuha sa supravital staining. Ano-ano yung tatlo na yon for supravital staining?
Reticulocytes, Heinz bodies,
Hemoglobin H. Good. So you have retics, Heinz bodies, and even hemoglobin H inclusions. Okay? The next one here is hemoglobin C crystal. So para mas maintindihan natin, I hope you can still remember this example as I gave you. When you deal with hemoglobin C, it is then associated with certain amino acid replacement on your globin structure. I don't know if you can recall this example I gave you, yung sa upuan, that if you change one foot of that chair, diba? Nabigay ko ba sa inyo yun as example?
Yes, sir.
Yes, sir.
Nangyari, your hemoglobin configuration changes because those amino acids should be arranged in an organized manner, right? So if there will be replacement on one of those amino acids, it changes the configuration of your hemoglobin, making them susceptible to hemolysis. And in cases of hemoglobin C, that's an amino acid replacement problem, okay? In cases of hemoglobin C, this will then be the appearance of your RBC. Parang everything is clear, and then at the middle, there will be some sort of bar of gold appearance. Okay, that's what you see on the picture. Parang it's hexagonal with blunt ends, and it's darkly stained, and it looks like a bar of gold. Okay? Which you commonly see in cases of hemoglobin CC disease. Take note ha, huwag kalimutan na dalawa yung C ha. Kasi pag dalawa yung C, ibig sabihin, your patient is homozygous. Both of your patient's globin are affected. Okay? Kasi pwede yung hemoglobin AC. Yung isa normal, yung isa abnormal. So usually, you form that bar of gold appearance when your patient is a homozygote. So ibig sabihin, both of his globins are affected. Okay? Then, ito, parang no way out. One of your globin is S and the other one is C. Both of them are abnormal. Similar with C, yung hemoglobin S na yan is also characterized by amino acid replacement. Okay? So malas mo kapag yung isa is S, napalitan yung isa ng S, and then yung isa, napalitan naman ng C. Okay? And if there's this SC formation on your hemoglobin, it will then result to some sort of crystalline-like projections with parallel sides, and yung isang end is medyo blunt or medyo pointed, which is associated, or they associate this sa mga literatures, they associate this with Washington Monument-like appearance. Okay? Washington Monument-shaped like crystal. And it happens if you have hemoglobin SC disease. Don't worry, yung mga hemoglobinopathies na yan, we will further discuss it and elaborate this on finance. Okay? Then moving on, you have here sideroblast. What does sideroblast mean again?
Immature RBCs.
Iron deposit.
These are immature red cells with iron deposits inside, right? It's like because of defective heme synthesis, iron that you have tends to accumulate within your cell. So makikita mo yan pag meron kang sideroblastic anemia, myelodysplasia where your cells are not properly formed or not properly developed. And to make sure that these granules here really are iron, what is that special stain that you need to do?
Prussian blue.
Very good. Please natandaan, di ba? You have pearl stain or you have Prussian blue staining. Okay? The next step is Pappenheimer bodies. Yan, usually, these are accumulation of ribosomes, accumulation of mitochondria, and even accumulation of some forms of ions. A little bit of iron fragments, which tends to accumulate at the periphery of your cell. Kadalasan nasa gilid. Okay? So because of iron accumulation, mitochondria or ribosome accumulation, you can then associate formation of these Pappenheimer bodies kapag merong thalassemia, merong sideroblastic anemia, again, because of iron deposits, defective erythropoiesis, or even sometimes in cases of hemolysis, in cases of hemolytic anemia, where portions or structures of your cells tend to accumulate. And if it's in the periphery, you further call it as Pappenheimer bodies. Okay? Then with parasitology, kung di ako nagkakamali, you are already through with malaria. Tama ba? At this point,
Yes.
ang alam ko ang
Yes, sir.
malaria. O what causes malaria?
Plasmodium.
Plasmodiums.
Organisms. Tama? And what transmits malaria?
Mosquito.
Mosquito.
Species.
Anopheles mosquito.
So as what you have learned in your parasitology class, once a person is infected with malarial parasites, they then target and then destroy your RBCs. Ayan, particularly si Plasmodium falciparum. Diba? That's the most the most dangerous species of Plasmodia. Bakit?
Na-attack
Bakit si
niya both
falciparum?
young and old.
All kinds of
Lahat po ng RBCs.
Kasi wala siyang pinipiling RBC. Tama? Whether it's a young red cell or an old red cell, they just destroy your RBCs. Unlike malaria, di ba, with Plasmodium malariae, usually, they just damage old RBCs. But with falciparum, all of them, di ba? Lahat yan. Young man yan or old red cells man yan, they destroy it. And as what you've learned, there are different stages that you may recover as you examine the blood of your patient when it comes to malaria. Di ba, you have the so-called ring forms. Yan, kadalasan, isa yan sa mga unang nakikita natin. Ring form kasi mukha siyang sing-sing. Right? You have the ring forms, you have your tropozoid stage, schizoid stage, and your reproductive stage, your gametocyte stage. Right? So, if you are suspecting for malarial infection, you further go with GEMSA staining so you can easily recover these malarial parasites. Okay? And sometimes, these malarial parasites here, ito yung actual picture niya sa smear. Okay, yan yung mga ring forms. Sometimes, this malarial parasite is mistaken as Babesia. Ito, tingnan yung picture. Mukha raw siyang malaria. Difference is that, number one, Babesia is caused by ticks. Unlike with malaria, that it is transmitted by mosquitoes. Ito, tick bite. Okay? And what makes it different is that Although it's not that visible here on this picture. Pero what makes babesia different from malaria is that if in malaria you have ring form, in babesia you have this thing called Maltese cross formation na nakikita nyo lang if there is infections with babesia. Okay? And then lastly, for RBC abnormalities here would be certain unwanted structures you may recover within your smear, such as agglutination. Yan, when red cells are clumping or aggregated without any pattern, without any pattern. Basta nagdikit-dikit sila, primarily because of antibodies. If there are unwanted antibodies attacking your cells, attacking your red cell antigen, then there may be agglutination. Yan, you can associate that in cold agglutinins or let's say kapag merong mga transfused unwanted antibodies. Okay? Then when you say Rolu formation, Rolu a stack of coin. Okay? Parang nagpapatong-patong yung RBC natin. So sir, when will it happen? Usually, your red cells there form a stack of coin if there is an elevated amount of plasma globulin. Okay? Plasma globulin. Or simply referring to your immune globulins. Right? Your antibodies. So, in such cases, you can then easily recover Rolu for myeloma or even in cases of macroglobulinemia. Natouch nyo na ba yan sa immunology class nyo? Multiple myeloma, does it ring a bell? Uy, does it ring a bell?
Nababanggit na po.
Hindi pa? Okay, so ayun. I'll further discuss that pagdating nyo sa mga diseases sa immunology. But ayan, multiple myeloma is a condition characterized by increased production of antibodies. Okay, macroglobulinemia. That then affects your red cells, thus resulting to this stacking of coins. Okay? So, lastly, within this anomalies, as I've said last time, it's important that we know how those structures look like. It's important that we know what are the diseases associated with those abnormalities that we have discussed. We know the indications. We know how to test them properly. But aside from that, for me, better way to address these abnormalities as medtech is to report them properly. Yan, if you will try to analyze, alam mo naman kung ano itsura ng sickle cells. Pero, do you know how to properly report it? Alam mo naman kung anong itsura ng target cell. But do you know how to properly report it? Kasi as medtechs, that's our part in the healthcare profession. Right? That's our duty. Diba? To give accurate laboratory results. And we need to report these abnormalities accordingly so that doctors can easily interpret them. Right? So listed here on this table is the proper way on how you can then report those specific abnormalities. For example, nakakita ka sir ng elliptocyte. Ang nakita kong elliptocyte sir, isa lang. Sa buong blood smear ko sir, isa lang po yung nakita ko. Tingin nyo, will it be considered as significant?
No.
No.
Hindi. Isa lang eh. Right? Isa lang talaga yung nakita nyo. Nilibot nyo na yung buong smear. Isa lang yung nakita mo. Technically, it's abnormal, yes, but it's not considered as significant. Kaya, there would be appropriate reporting for that. Take note, this field here that we are referring to is OIO, per OIO field. Okay? Then, there are times when presence of an abnormality just needs to be reported as positive. Kunyari, nakakita ka ng sickle cell, no need to count them, no need to enumerate them or quantitate them. Just simply write as positive with sickle cells. Okay? Sige, before we go on with WBC abnormalities, do you have any questions or clarifications with our BCs?
Wala naman po.
Okay. Sige, so moving on. The next one that we have here will be your white cells. As what you know, white cells are the protectors of our body, right? White cells are the soldiers of our body, and these WBCs could be further classified as either phagocytes or immunocytes. Sino yung mga immunocytes natin?
B-cell.
Uy, sino yung mga immunocytes natin?
Lymphocytes po.
Lymphocytes. Right? So you have your B cell or your T cells. Tama? Then, the rest will then be considered as phagocytes. Right? Mga phagocyte na yung mga yan. So, our concern for today when it comes to these abnormalities would focus more on the abnormalities affecting your neutrophils. Bakit, sir, si neutrophils? Kasi neutrophils, number one, is the most abundant white cell. And number two, neutrophils would be the first set of cells to attack a foreign organism through phagocytosis. And if you can recall it, if you want to further identify WBCs, what we do in the laboratory is we check the nucleus and the cytoplasmic characteristic of your cells. Right? O kunyari, if it's bilobe with red-orange granules, most likely, what is that cell? If the nucleus is hardly observed and it's covered with darkly stained purplish granules, what would be that cell? Or basophils, and so on and so forth. Right? So that's how we should properly identify your WBCs. Right? And when it comes to your neutrophils, yeah, particularly with phagocytosis, as you've learned in immunology, di ba, these phagocytes remove a foreign body or an unwanted structure through phagocytosis. And you know the steps in phagocytosis, tama? Sa iba't ibang book, iba't iba yung step nila. Yung iba, shorter version, yung iba, longer version. Right? But with the longer version, the first thing that happens if there will be phagocytosis is recognition. Tama? There will be recognition, right? Your body will recognize that there is an unwanted material in your body. May it be an organism, a microorganism, or a tissue debris, or a cellular debris. As long as it's an unwanted body, diba? Your body will recognize it. Your white cells will recognize it, right? After that, your white cells will undergo chemotaxis and diapidesis. Okay. Sige, I'll just call someone, ha? Randomly. Sige. Let's call Gubalia Francesca.
Yes po, sir.
What's the difference between chemotaxis and diapidesis?
Sir, yung chemotaxis po yung directed migration ng cells in response of yung concentration ng gradients ng extracellular signals. Wait lang po yun.
Sinesearch pa sa Google. Ano yung
Yung
diapidesis?
diapidesis po, sir, hindi po ako sure ano po yung diapidesis.
Di ba? Pag sinabi natin chemotaxis, it's the movement of white cells because of chemoattractants. Saan nanggagaling yung chemoattractants? Chemical attractants. Saan nanggagaling yon?
So foreign, po?
Sa microorganisms. Right? Once they enter your body, di ba, they will release out those chemical attractants that further attracts your WBCs. So in chemotaxis, because of those chemical attractants, they move towards that area of foreign organism. When you say diapedesis, it's whenever your white cells leave the blood vessel without causing any injuries. So imagine niyo, ito yung blood vessel nyo, ito yung WBC. Pag sinabi nyo diapedesis, lalabas sila sa blood vessel nyo, going to the site of injury, going to the site of inflammation without causing any damage within your blood vessels. Tama? Oh, I hope you can still remember that, ha? So, they had diapedesis, they had the chemotaxis later on, diba? They bind on your microorganism. It will be further enhanced by what? How do you call that substance? That further enhances attachment of your white cell to that foreign body. Opsonins. Yan, good. Diba? Through opsonization, there will be enhancement of the attachment. Then later on, diba, your white cells will further engulf it. You'll form phagosome, phagolysosome later on until your white cell has totally released its enzymes that will kill the ingested foreign body. Tama? So basically, that's how your white cells, particularly your neutrophils, will destroy that foreign organism. And these white cells here may also have this thing called shift to the left and shift to the right. Hindi lang si red cell yung merong left at saka right shift. Okay? Pag sinabi nating shift to the left, listen well, when you say shift to the left, it's whenever there is an increased release of precursor cells from your bone marrow. Meaning, there is an increased production of cells from your bone marrow. So, sir, what is that? How do we know, sir, if there has been an increased release of cells from my bone marrow? You can then check for the presence of your band cells. Question: are band cells normally present in the blood?
Yes.
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 They are normally present. Tama? They are normally present, but if in your blood, you have a lot of band cells, you have recovered a lot of band cells, it might then indicate that there has been an increased production of cells and increased release of cells from your bone marrow. Kasi pag meron kang left shift, it does not necessarily mean that you have neutrophilia. Anyone, what is neutrophilia? Philia. What's neutrophilia?
Increased amount of neutrophils.
Increased number of neutrophils. Tama? Increased neutrophils. So, in left shift, you have a lot of band cells, but it does not mean that your neutrophil count is also elevated. So that gives you an idea na on your bone marrow, there could be an increased production of cells. There could be an abnormal production of cells. Okay? Then when you say right shift, it is when your neutrophils are hypersegmented. Normally, how many lobes do neutrophils have?
3 to 5.
2, 5.
3 to 5. So pag sinabi natin shift to the right, it's whenever the lobulations of your neutrophils are elevated. Okay, more than 5. So sir, kailan po mangyayari yung hypersegmentation? Kailan po mangyayari yung shift to the right? It occurs whenever your cells did not mature properly. Okay? Hindi lang yung sa red cell. It's also applicable with white cell. Here's the thing. Paulit-ulit kong binabanggit sa inyo a while ago and even last time. When will megaloblastic state happen again?
Incomplete or improper development.
Improper development. Okay. When will it happen? If there is
Nutrient deficiency.
nutrient deficiency. Oh, for example, vitamin B12 and folic acid. What for are these two again? Nuclear metabolism. Right? For your DNA. Tama? Question. Do immature red cells contain nucleus?
Yes.
Yes.
So they need this, right? Do white cells contain nucleus? Mature or immature man yan?
Yes.
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 So, question, do they need the same minerals or nutrients?
Yes.
Yes.
Yes. So, point is, if there is, sorry, napi ako. If there is shift to the right, if there is shift to the right or your neutrophils are hypersegmented, it means to say that your red cells will also be abnormal. And what are those abnormalities that you may recover again if red cells are abnormal when it comes to megaloblastic states? How would your red cells look like? How would your red cells look like?
Bigger in size.
Bigger.
So pag meron kang hypersegmented neutrophil, expect that your red cells will also be macrocytic. Tama? Anong shape niya kaya? Most likely. Uy!
Elongated. Tas broad.
It is something oval in shape, right? Diba yung mga ovalocyte natin? Tama? And a while ago, you have a lot of inclusions that may then indicate improper development of cells. Kaya, pag sinabi niyong megaloblastic state, tandaan na, it's not only dealing with RBCs. When you say megaloblastic anemia, yes, that is focused with RBC, but it does not mean that in megaloblastic state, only red cells are affected. If you will try to analyze it, even your platelets are affected. Bakit? Yung megakaryocytes nyo also contain nucleus. Diba? So kung meron silang nucleus, kailangan din nila ng same set of minerals or nutrients. Right? Yan, pagdating natin ng finals, we'll further associate those diseases. Okay? So when you say right shift, going back, it's whenever your whenever your neutrophils are hyper-segmented. And lastly, before we go with those abnormalities, your WBCs could either be, generally, could either be on your so-called marginating pool or circulating pool. Pag sinabi nating marginating pool, you are then referring to white cells that is circulating within your blood and they are searching for inflammation. Once they see an inflammation, they leave your blood and goes to the site of inflammation. Nakuha ba yun?
Yes.
Yes.
Pag sinabi naman nating circulating pool, so these are your WBCs that are circulating in the blood and leave your blood through random migration even without inflammation. Lalabas lang sila. O sabihin natin, trip lang nilang lumabas. Okay? Kasi wala naman silang makita sa blood mo. Wala silang magawa sa blood. So they leave your blood through random migration and never go back to your blood again. And that's one reason on why ME ratio gives higher proportion for your WBCs as compared to your red cells. Ano huling normal ME ratio natin?
4:1.
4:1.
2:1 up to 4:1. Right? Mas marami tayong white cell precursors compared with red cells. But in your blood, mas maraming red cell kesa sa white cell because your margination and circulation pool. Do you follow?
Yes, sir.
So when it comes to neutrophilic abnormalities, it's just further classified into two. It's either you have nuclear abnormalities or cytoplasmic abnormalities. Pag sinabi natin nuclear, you just count the number of loops. So it's either more than 5 or less than 3. Kasi ang normal natin is 3 to 5, right? So the first one that we have here is Pelger way. Pelger way or known as hypoxia hyposegmented neutrophil. Hyposegmentation, which will then appear as a neutrophil that is bilobe, which will then look like pin's nest or parang ilong, pin's nest or dumbbell or peanut shape in appearance. It's like your nucleus here failed to divide into segments. Here's the catch. Looks could be deceiving. Your neutrophils here look abnormal, but function-wise, take note, in Felger way, your neutrophils still function well. Nakuha ba?
Opo.
And as to genetic studies, it has been associated with lamin gene, which is important for the coding of your nuclear lamina, for them to divide. So because of certain mutations on your lamin gene, your cells now fail to divide into segments. And at some cases, literatures are also saying that or suggesting that your Felger way is formed if a person is taking chemotherapeutic drugs. Yung mga third generation chemotherapeutic drugs. It may also result to a Felger way. But take note, still, your WBC looks normal. This is how it looks like. Okay? Yung Felger way natin. Then when you say pseudo-Felger way kasi bilobe pa rin siya. Pseudo because this time around, it's an acquired anomaly associated with various diseases, as what's written there on that slide. And up to some point, the function of your white cells now may be affected. Kaya tinawag siya na pseudo-Felger way. Okay? Then as mentioned a while ago, how many lobes again when you say shift to the right or hypersegmentation?
More than 5.
More than 5.
More than 5. And when will it happen again? When will it be formed?
Improper maturation.
If there is improper maturation or abnormal DNA synthesis, right? Because of those nutritional deficiency. Kaya your nucleus now resulted to multiple lobulations. More than 5 lobulations. Okay? Then cytoplasmic-wise, para may heads up kayo. Cytoplasmic-wise, it's quite difficult to identify them under the microscope kasi when it comes to the cytoplasmic abnormalities, on a single glance, mukha siyang normal. Okay? Parang pang nadaanan mo siya, mukha siyang normal. But if you will pay a closer attention to details of the cell and associate this with the condition of your patient, that's the time you may then point out na yung cell pala na yon is actually abnormal. But in a single glance, mukha siyang normal. Okay? Mukha siyang walang problema. But having a closer look or a closer attention to the details of the cell will then tell you that there's something wrong. Okay? Kaya practice, experience will really be essential so you can easily master the identification of these abnormalities. And the first one that we have here is known as Alder-Riley anomaly. Okay? With Alder-Riley anomaly, di ba, pag unang tingin nyo sa microscope, mukha naman siyang normal. Right? Hindi mo lang makita masyadong nucleus, but mukha siyang normal sa unang tingin. But these large granules here that you see are not actually the granules of a normal WBC. Those granular-like appearance you see are actually an evidence of mucopolysaccharide accumulation. Normally, yung mga cells natin, especially yung mga nucleated cells natin, yan, yung mga leukocytes natin, they do contain mucopolysaccharides. It's normal. Okay? Problem is that if you lack enzymes necessary to metabolize them, those mucopolysaccharides tend to accumulate. So pag nabuo at hindi mo na metabolize yung mucopolysaccharide na yan, they then accumulate on your cell, and will your WBC now, your neutrophil now, will appear something like this. Okay? So sir, will it affect the function of my white cell? Yes. Hindi na ngayon makapag-function ng maayos yung white cell to destroy a foreign organism because of this accumulated mucopolysaccharides. Okay? And up to some extent, ito yung mga enzyme deficiencies, up to some extent, having aldehyde anomaly or accumulation of these mucopolysaccharides within your cell may then result to mental retardation. Yan, Sanfilippo's, Hunter syndrome. Aside from WBCs kasi, other cells and tissues also contain mucopolysaccharides. And to metabolize them, you need different enzymes. So it's not only affecting your WBCs, but it also affects other tissues within your body. Ayan, umaabot pa. Even hanggang sa nervous system natin. Okay? And take note, this aldehyde anomaly here sometimes is confused as toxic granulations. It is confused as toxic granules. The difference is that toxic granules are seen in cases of infections and toxic states. Toxic states like burn. Let's say na-burn yung pasyente nyo. So that's the time makakakita ka ng toxic granules. But if it's because of those mucopolysaccharide, you just simply call it as aldehyde anomaly. Okay? Then on this picture, can you see this cigar shape or rod shape structures? Nakikita ba? Yung naka-arrow?
Yes.
Medyo po.
Yes, sir.
Great. You call them as our rods. In granulopoiesis, what is that stage that will show us first your primary granules?
Promyelocyte.
Promyelocyte, right? So what happens here is that in our rods, they are formed because your primary granules fused. Nagdikit-dikit sila. And you can test it with peroxidase. Positive yan sa peroxidase state. But when those primary granules fuse, which is usually associated with leukemia, you will form your our rods. Okay? And if a cell contains mass of our rods, punong-puno siya ng our rods, you then further call that cell as pagod cell. Okay? You just use that in describing cells. Do not use the term in describing people. So kidding aside, so if you have mass of our rods within your cell, so you just simply call it as pagod cell. And again, it is usually associated with different forms or different types of leukemia. Yan, commonly, pwede nyo siyang makita sa AML. Acute myelogenous leukemia. Okay? The next one here is Chidiac-Higashi. So if in our rods, your primary granules fused, in Chidiac-Higashi, your primary and secondary granules fused. Nagdikit silang dalawa. Okay? So sir, what will be the effect? If your primary and secondary granules fuse, your neutrophils now become less chemotactic. Your neutrophils become less chemotactic because of membrane defects. Okay? Naapektuhan na ngayon yung function ng WBC natin. And that's why patients with Chidiac-Higashi anomaly are susceptible in acquiring different forms of infections. And And the most common organism infecting people with Chidia-Higashi is Staphylococcus aureus. Familiar?
Yes, sir.
Oh, for sure, kilala niyo si Staph aureus, right? So that's a common organism attacking or infecting patients with Chidia-Higashi. So, in Chidia-Higashi, aside from affecting your WBC, it also affects your platelets. Kaya yung platelets natin meron ding granules. And as to genetic studies, this Chidia-Higashi has been associated with mutations on your LYST gene. So sir, para saan po yung LYST na yan? You listen well, ah? Your LYST gene gives us some sort of instructions about the movement and regulation of proteins within your cells. Okay? Movement of granules, regulation of proteins, yun yung trabaho ni LYST. Isipin nyo, ganito, para siyang traffic light. So, kung merong traffic light, di ba, in an ideal world, in an ideal setting, pag merong traffic light, the flow of cars, the flow of vehicles would be smooth. Right? But imagine, sira yung traffic light. Nagloloko yung traffic light. Obviously, there will be chaos. There will be chaos in the movement of vehicles. So similar with your cells, if that LYST gene mutates, there will be uncontrolled movement of substances within your cell, now causing the fusion of your primary and secondary granules. Nakuha ba?
Yes po.
Yes.
Naintindihan ba yun?
Yes, sir.
Then for patients with Chidia-Higashi, physically, they are characterized to be albino. So yung hair nila, yung skin nila, yung mata nila, yan, namumuti. Because the granules may also affect those pigments you have on your skin tissues. Okay? The next one that we have here would be dull bodies. Tignan nyo. Without looking at the arrow, di ba, mukha naman siyang normal. Right? But having a closer attention to the detail of the cell, you will see blue inclusion body. Large blue dot or large blue granule inside. And that blue inclusion there is an evidence of ribosomes and endoplasmic reticulum aggregation. Nagdikit-dikit sila. And it happens whenever your patient has infection or is experiencing toxic states. Ano uli yung kanina na makikita nyo during infection and toxic states?
Alder-Riley.
Hindi Alder-Riley. Nilinaw ko na nga kanina yan. Toxic granules, not Alder-Riley. When do you see Alder-Riley?
WBC.
When do you see Alder-Riley? Mucopolysaccharide. Tama? Yung toxic granules kapag meron kang infection or toxic state. It's just that toxic granules are mistaken as Alder-Riley. Is that clear?
Yes, sir.
Po.
In this dull body here, because of its appearance, because of that blue inclusion inside, sometimes it is then mistaken as May-Heglin anomaly. Yung May-Heglin anomaly on the red with the red arrow there. It's also a blue inclusion, but this time that blue inclusion is derived from your RNA. And to differentiate your May-Heglin from dull bodies, for some unknown reason, having May-Heglin anomaly also results to giant platelets. Because of these giant platelets, there will be thrombocytopenia or mababa yung platelet count for some unknown reason. And it could be associated with a mutation or a problem with your MYH9 gene, now causing your Mayhegline. Ulitin natin. Sino uli yung kamukha ni toxic granules? Tayo nakakakita ng toxic granules.
Infection.
Sa mga infection and
Infection or toxic states. Right? And sometimes, aside from toxic granulation, you may have toxic vacuoles. Pag meron kang infection, magkakaroon ng vacuoles yung mga neutrophils mo. But sometimes, your toxic granulation is more of artifactual. Anong ibig sabihin ng artifactual? Meaning to say, there has been technical errors on why your cells develop toxic granulation. Sir, what's the technical error? It's poorly staining of your smear. Okay? You failed to stain it well. You failed to use the appropriate stain. You failed to filter out your stain. So that's why there may be certain toxic granulation on your cells. But physiologically, you may have these toxic granules pag meron kang infection or toxic states. Okay? And then lastly, before we go with lymphocyte abnormalities, we have this thing called lupus erythematosus cell and TART cell. So when you say LE cell, this is actually a neutrophil yan with ingested round inclusion body. And usually, those are from immune complexes or immune activities because of the disease that you have, yung lupus. Okay? When you say TART cell, this is a monocyte with an ingested lymphocyte. So sir, bakit niya in-ingest yung lymphocyte? Probably because your lymphocyte is infected with something. Kung virus man yan or whatsoever. Okay? But both ways, pareho silang merong bilog sa loob. Kaya sometimes, they are confused with one another. They are mistaken as an LE cell or as a TART cell. Kaya yung TART cell na to sometimes is known to be as pseudo-LE cell. So sir, how do I know which is which? So if you will examine Buffy coat specimen and you stain it, if it's an LE cell, look at the staining pattern. Your LE cell looks smooth. Smooth because it is evenly stained. Diba? Walang mga spaces. Unlike if it's TART cell, it looks rough because there are unwanted spaces, there are vacuoles, or in short, it is unevenly stained. Okay? So, LE cell, again, usually could be recovered if you have lupus or SLE or immune activity, increased immune complexes or activity. Whereas in TART cell, it is whenever your lymphocytes are damaged or infected with something, that's why monocytes will then ingest them. Okay? Then lastly for today, you have your lymphocyte abnormalities. And pag sinabi natin yung lymphocyte natin is reactive, it means to say that your lymphocytes are responding to a certain stimulus. Meaning, your lymphocytes are reacting into something. Pwedeng kasi meron kang infection, meron kang microorganism. That's why your lymphocytes are stimulated. And if they're stimulated, if they are reacting into something, you further call them as atypical lymphocyte or stimulated lymphocyte. And as an atypical lymphocyte, you have three types. You know, you call it as Downy cell and you have three types. Type 1, type 2, and type 3. Pag sinabi nating type 1 Downy cell or type 1 atypical lymphocyte, you have their blocks of chromatin bodies within your cell. Merong mga buo-buo na malalaki na makikita nyo sa nucleus at sa cytoplasm. If it's type 3, you will see a lot of vacuoles on your cytoplasm. And among these three, one of the most popular is type 2. Kasi yung type 2 downy cell is the one associated with infectious mononucleosis. Infectious mononucleosis is or a condition caused by a virus known as Epstein-Barr. Okay? Epstein-Barr virus. And this Epstein-Barr virus, take note that infects your B cells. So, kunyari, ito sa Epstein-Barr, it will then infect your B cells. So, pag sinabi nating type 2 downy cells, this will refer to T cells that will react against B cells because your B cells are infected with Epstein-Barr. Nakuha ba yun? Uy, is that clear?
Yes.
Yes po. Yes po.
So what is the nature of a type 2 downy cell again?
T cell.
T cell or B cell?
T cell.
It is a T cell. Okay? Reacting to B cells infected with the virus. Okay? Then, if your cells or if your lymphocytes look like this with the generated nucleus, you can call it either as a basket cell or a smudge cell. So, sir, when do I call it a basket cell? You call it as a basket cell if it is formed because of increased pressure as you prepare the smear. And kapag isa, dalawa, tatlo lang yung nakikita mo, you just call it basket cell. It's just because you have applied too much pressure on your slides. So para maiwasan yon, you can add albumin, bovine albumin on your slides. But if in every field, sa kada field na bibilangin mo on your microscope, on your smear, you are looking or you are observing for the generated nucleus, you further call it as smudge cell. Because if the nucleus is degenerated, it tells you that there's something wrong. And having smudge cells are usually associated with leukemia. You call it as chronic lymphocytic leukemia. Okay? Pero pag konti lang and just because of smear preparation, you just simply call it as basket cell. Okay? Then, another one here is a B cell. So this is a B cell, okay? With hair-like projections. That's why you call it as hairy cell. Okay? Again, we will further elaborate dan pagdating natin sa finals, ha? Yung mga types of leukemia and even anemia. But with its appearance, this is a B cell with hair-like projections. That's why you call it as hairy cell, which is obviously related to hairy cell leukemia. And to confirm that this is really a B cell associated with leukemia, you can perform special staining with TRAP. Kasi yung hairy cell natin is positive with TRAP. So sulat nyo yung ibig sabihin, ha? That stands for tartrate-resistant acid phosphatase. And that is unique for hairy cell leukemia. Okay? Then, when the nucleus of your lymphocytes is convoluted, cerebriform, parang may mga convolutions like yung brain natin, yung mga parang waves, you further call it as Sézary cell. Okay? Having that groove or convoluted nucleus, which is seen in cases of lymphocytic abnormalities known as mycosis fungoides or Sézary syndrome. Then the last two are abnormalities affecting your plasma cells. Saan uli nang gagaling ang plasma cells natin? T cell or B cell?
B cells.
Right? So when B cells mature, they become plasma cell. And what's the main job of plasma cells?
Production of
antibodies.
Production of antibodies. Right? Production of immune globulins. Right? So, whenever your plasma cells are producing more than enough antibodies, it is then associated with abnormal release or abnormal production of such protein, which is normally seen in cases of multiple myeloma. And because of this increased activity, sipin nyo, parang natotoxic yung cell natin. And as you stain them, it will appear like your cytoplasm becomes reddish or pinkish instead of being purple or basophilic. Kasi nga, ang dami mong ginagawang antibodies and excessive production. Excessive which is not necessary. That's why your cell here is further called as flame cell because of this red or pink appearance. Okay? And with the next one, siguro as you see here on this picture, it's quite obvious on why it is called as grape cell. Grape cell or berry cell or morula cell. Yung mga bilog-bilog na yan, yung mga nakikita nyo na yan, yung mga bilog-bilog na yan, you call them as Russell bodies. Sir, what are Russell bodies? Russell bodies are the individual globules of immunoglobulins. Yan yung mga immunoglobulins natin. Okay? So just like in flame cell, if there is increased production of antibodies or immunoglobulins within your cell, you can, in cases of multiple myeloma, you can have this appearance of your plasma cell. So pag merong multiple myeloma, pwede kang makakita both ng flame cell at saka ng grape cell. Okay? So with that, do you have any questions or clarifications?
Sir, sa exam po ba kung sakali maglalagay po kayo ng pictures?
It depends. Pwede. Ayan, you give me an idea. Pwede ako maglagay ng picture. Sige, so kung wala na kayong tanong, I'll see you later at 5 p.m. for your laboratory class. Okay?
Thank you,
Thank
sir.
you, and
Thank
you
you,
may have your
sir.
break.
Thank
Have a
you
nice day.
po.
Sir.
Thank you po.